When a patient loses a tooth, it's both physically and also emotionally very devastating to the patients. When you lose a tooth, the neighboring teeth and then the opposing tooth, whether it's from the top or the bottom, they're going to start moving around. And then over time, it doesn't happen overnight, but over time it can get the bite out of line. So in order to avoid that, implants are the new way of replacing those missing teeth. In the past, we used to use the partials. They were like foreign objects that you put in the mouth, and then the patient would put in and take them out. Or we used to go ahead and do bridges. With implants, the advantage of implant is that you don't have to go ahead and then prepare the neighboring teeth or the adjacent teeth to provide a replacement. So implant is just a single tooth by itself, which is placed in the area of the missing tooth. Now there are some patients that are missing many teeth, or they are just have missing all their teeth, so they have dentures. The dentures are never comfortable. They are always loose in the mouth. So when you put the implant in the patient's mouth, and then the dentures can sit on top of it, and many times the dentures don't have to be as bulky. They can be very thinned out, so the patient doesn't notice it in their mouth as much, and then nobody knows even that they have it there. So when they are having a lunch or dinner at a restaurant, they don't have to take them out. They don't have to worry about that, those noises, when they chew on their corn cob, or on steaks, or chicken fried steak or whatever. They can just chew it very easily without being worried about the dentures, making all those clicking sounds or coming out, or they don't have to clean their dentures after they have meal at the restaurant. Those they sit firmly. Some of them can be permanently seated in the patient's mouth, and some can be removable that they can just take it out after before they go to bed and clean it up. They provide more stability and more cosmetic for the patients.